Ladies and gentlemen, we are coming to the close of our ABDA online conference on medicine shortages now, and this conference was held under the German presidency of the Council of the European Union. And pharmacists, as we are, among others, are warning since a long time of medicine shortages. 9 out of 10 pharmacies emphasize that delivery bottlenecks are their biggest annoyance. Medicine shortages mean a lot more work for our colleagues. On average, a pharmacist spends a whole working day per week procuring alternative products, consulting doctors if the original is not available. However, in our conference, we tried to concentrate not so much on the problem, description of the problem, but on finding solutions. In COVID crisis, the emergence of problems levels that are largely beyond the scope of national processing became particularly clear through impending or actual delivery bottlenecks for pharmaceuticals. The crisis has heightened awareness for medicine shortages and revealed even more how serious the problem is today. Therefore, at the beginning of the corona crisis, Federal Minister of Economics in Germany, Peter Altmaier, demanded that certain products, such as drugs, should be increasingly produced in Europe, or even better, in Germany. Our health minister, Jens Spahn, stepped up again in October by stating that he wanted to strengthen the European production of active ingredients in pharmaceuticals. He called policy and stakeholders to think about which instruments can be used to stimulate production and supply in Europe again. It is accordingly gratifying and consistent when there is now more talk about a coordinated European approach to health protection in the context of pandemic risks. It is accordingly logical that reducing Europe's dependence on the South and Southeast Asian active ingredients in pharmaceutical production is now on the Union's agenda. Both problems require joint efforts. However, until critical drugs and active ingredients can again be produced in Europe, if ever this will be possible, this will take quite a bit of time. In the meanwhile, the daily challenge to provide the patients with the medication they need is a local problem in our pharmacies. Pharmacists have shown in the COVID crisis that we addressed this problem very successfully. To be able to do so, we relied on national regulation that allowed us to substitute medicines without being punished by retaxations for our efforts to supply our patients. This also shows that a big part of the solution is at the national level. Therefore, national governments and health systems need a degree of freedom and the continued ability to determine the level of care they deem to be appropriate, as well as the organization and financing of the health system according to their needs, expectations, and financial abilities. The particular challenge for the planned European action will be not to overshoot the mark in view of this collective impetus. In terms of consistent subsidiarity, the diversity of historically evolved health system must continue to be respected. The integrity of a regulatory framework that is consistent in itself must not be compromised. The logic of the internal market must not be applied uncritically to healthcare. How quickly and how momentously this can happen anyway, we have seen in Germany with the question of fixed prices for prescription drugs, with the European Court of Justice challenged in 2016, and the at least partial restoration cost us 4 years of hard work. It is important that the Union is flying at the right altitude. It is good if it represents and enforces European environmental and social standards in the context of globalized pharmaceutical production. It is good if it promotes the maintenance and establishment of production sites in Europe. But it would be wrong if it intervened in the complex machinery of fixed prices, discount contracts, and co-payments in the statutory health insurance in the member states. Then, according to Democritus, the most pleasant quickly becomes the most unpleasant when the right measure is exceeded. That's all for today, ladies and gentlemen. We're coming to a close now, and I want to thank you all for having been our guests today. Special thanks to all our great panelists and our wonderful host, Wendeline von Bredow, this morning. My special thanks are going to our staff, ABDA staff here in Berlin and in Brussels for organizing this conference for us. It's December the 1st, so it may be acceptable to wish you all a Merry Christmas and Happy New Year. Maybe I'm the first one who does that to you. And in these special times, take care and stay healthy. Goodbye to all of you.